All right, well, welcome everybody to the Hubs and Spokes for Aging and Disabled Californians Town Hall, the first in a series. Before we get started, and I toss it over to folks from CDA to take it away, just covering a couple of logistics items. Participants will be muted during presentations, but we do have ample time saved towards the end for public comment. You can use the raise hand icon on your Zoom toolbar or Q&A to submit your comment or question. Closed captioning and ASL is available. You should be able to see our ASL interpreters on your screen. Closed captioning will need to be enabled. Just click the CC icon on your Zoom toolbar to get your subtitles going. And the presentation and recordings will be archived. You can visit CDA's YouTube channel or the Hubs and Spokes Network webpage to access the slides, the recording, and transcript. And with that, I will pass it over to Connie.
Great, thank you, Maria. Good afternoon, everyone. Thank you for joining us today. Today is actually our first of 4 regional virtual town halls. So thank you very much for joining us. Just to go recap some of the stakeholder engagement opportunities we have, we were glad that you're able to join us today. We have several planned throughout the rest of the year. The first we had was back in July. We had our initial kickoff meeting. Today is our first of 4 regional virtual town halls. We have 3 more set for next is on September 14th. We have the San Francisco and Bay Area region. September 28th is the rural and remote California regions, and October 12th will be LA and Southern California regions. We're also excited that we have a public survey that has launched today. That is also available on our website under the Hubs and Spokes webpage. The public survey is available for everyone, and we encourage everyone to take part in the survey, to submit your feedback regarding the proposed Hubs and Spokes model that we're discussing today. Also, we have webinars with expert researchers planned for September 8th and also September 15th. And also there's written recommendations also welcomed. If you can't participate in any of the town halls or the survey, we welcome those via email as well. In December, we're looking to have a results and recommendation briefing. So the date is still TBD, but in December, that is the date where we are looking at hosting that. And we encourage all the feedback by October 15th. Next slide, please. So the next steps with that, again, we're encouraging all the feedback, comments, and questions to be submitted by October 15th. CDA and the California Commission on Aging will host the results and recommendation briefing in December in partnership with Sacramento State University. So we're excited with that. What this means is, 2022, this is all TBD. It could include state bills, budget, and local actions to develop and advance recommendations. Next slide. So today's agenda really quickly, what we'll do is we're going to go through very quickly the opportunity for California to build back better. We want to talk about the vision, the Hubs and Spokes for Aging and Disability in every community. We'll listen to a couple local perspectives, and they'll tell us about opportunities, challenges, and advice and recommendations. And then the important portion is we want to be able to have public discussion regarding any feedback or questions or comments regarding today's materials. So now let's get started. I'll turn it over to Ellen Schmetting.
Hi there, good afternoon. Thank you so much for inviting me. I'm Ellen Schmetting. I'm the current chair for the California Commission on Aging, and we're the principal advocate for older Californians. We're appointed for up to 2 3-year terms, and our work is focused and supported by a staff of 3. Our mandate to provide input to the legislature and governor gave us a unique opportunity to be involved in the development of the master plan for aging and ongoing monitoring of implementation. And currently, I am working with St. Paul's Senior Services. And in that venue, we have residential care, assisted living, independent. We also have memory care and skilled nursing, as well as the program for all-inclusive care for the elderly. As well, prior to coming to St. Paul's, I worked with the County of San Diego at a local area agency on aging and was there more than 20 years. We in San Diego at Aging and Independence Services were one of the first 2 aging and disability resource connections in the nation. And we saw firsthand what it meant to develop a one-stop shop. In the late 90s, as part of a super agency, Health and Human Services, we adopted the no wrong door approach. And we used that for seniors in our community. We integrated the Older Americans Act programs, the social service programs of in-home support services, adult protective services. And our motto was, when you don't know where to turn to us. We saw firsthand what it meant to our community to have an easy way in and expert assistance providing care and services through that one-stop shop. In my current role at St. Paul's, it is just as clear to me how important it is for seniors and family members to know what the resources are, how to access them in a time of need, and to find caring professionals on the other end. Next slide, please. So I don't have to tell all of you how much is happening right now with seniors in our state. In a few short years, we will have 25% of our population 60 plus. And for the first time ever, this group will surpass young persons up to 18. So what is so unique about this group? One thing they have in common is with seniors of all times, they prefer to live at home or in their communities with a loved one. We heard recently too from 2 nationwide polls, SCAN Foundation and AARP, to reinforce this, 88%. So this isn't a surprise to any of us. Many enjoy living in communities such as the ones operated by St. Paul's, and many others would like to receive care and support to age at home. But the older adults of today and tomorrow are very different. Many of them don't look at retirement in the same way. They want to continue contributing everything they have through paid work, volunteering. A lot of times the income is important to them. Other times it's the mission and purpose that they receive from remaining engaged that really matters. And many older adults are caregivers. They are caregivers for their loved ones, their partners, their children, their grandchildren, and then they comprise many of the volunteers that keep our nation strong and vibrant. Next slide, please. So what we've gone through in the past year and a half has been unprecedented and historic. The COVID-19 vaccine has shattered norms, and it's created a tremendous sense of urgency to get things right so that we can serve seniors to the best of our abilities. We've had to adapt to an emergency situation and pull up resources that we never knew we had available. I'll just use Zoom as an example. It is such a privilege to be here with you today and to have an opportunity for all of you to participate on the phone, via Zoom. These are things we just didn't utilize to the extent we now are able to. Telehealth has been so important to those we serve at St. Paul's and across the nation, connecting with doctors and health professionals to make sure that care was provided. We also have seen innovative partnerships. Getting meals out has been an amazing resource for so many, and there's been many different persons that have been working hard to make sure those basic needs are met. The master plan for aging came amidst all of this activity and was released in January of this year. It offers a bold vision at a time when we must change the way we deliver services. We have to in order to move forward. We can't do things the way we've always done. Population with so many different needs. So I can honestly share with you that in the time I've worked in this field, I've never seen the type of financial resources becoming available for services for older adults and persons with disabilities. We have monies coming from Older Americans Act, we've got federal dollars, state dollars, and now Department of Healthcare Services has put forward with the legislature the Home and Community-Based Care Spending Plan, $3 billion I can say just personally for the folks we serve, the supports for caregivers, both paid and unpaid, are tremendously important, helping us to move forward to provide the service that's needed. So this offers us a once in a generation opportunity to build back better, to create a system that connects people with the services they need. This is fundamental to allow them to meet their wishes, to remain at home and as independent as possible for as long as possible, with support with their needs being met. So next slide, please. Well, the governor's master plan has many bold goals, and the California Commission on Aging is right there next to the California Department on Aging and many others in providing support for the master plan. Some of the initiatives that we have lent our support to include this very one we're involved in right now, revisiting the Area Agency on Aging at the local level to better position ourselves to meet the needs and to make sure services are accessible and available in an equitable fashion. I also talked about with you all the importance of having that no wrong door, the way into the service network with information and assistance, and the governor's office's leadership position. This is one that we feel extremely strongly about because at the state governor's office level, having an entity that will hold us all accountable and help to drive forward the change that the master plan indicates will be going on. So what's happening ahead? We haven't taken at the commission, we have taken no current position on how the AAA structure might be reconfigured. We're really here to listen and learn from all of you as to how this should look at the local level. But one thing I can share is we have a tremendous opportunity with leadership. We have the master plan. We have dynamic leadership with Kim Mccoy Wade and her exceptional staff and the team, and Secretary Gailey, all of whom are willing and listening for input, and this is where you come in. Finally, I would just like to say how exciting this is for me to be a part of this. I think California's always been a leader, will continue to be a leader, and the master plan is our roadmap. We know things will change, but it is our roadmap for moving forward. And it's very, very exciting to be here and now as these key topics are being considered. So now it's a great pleasure to introduce Kim Mccoy Wade to talk with us about the vision for hubs and spokes for aging and disability in every community. Thank you.
Thank you, Ellen, and thank you all of you who, as Ellen said, it's a shame we're not all together in Fresno or in Sacramento or somewhere in the Valley, but it is great that so many of us are together in a safe way. So I'm thrilled to be with you and listen. I'm going to have a few minutes to share with you what we have already heard in 2 years of listening as we have held the Master Plan for Aging stakeholder process, and I was able also to participate in the governor's Alzheimer's preparedness task force with Maria Shriver and hear hundreds and hundreds of recommendations about how we move forward. And one of the clear themes is leadership. California leads. And so what I'd like to share with you today is a possible vision that we think we have heard from lots of folks and continue to develop and refine it with all of you. So let's start with why. Any of us who have tried to access aging services or disability adult services may have had the experience on the left. This is what we have heard from many people all around the state. The picture on the left shows people and services and organizations with arrows going in all different directions. It looks a little bit like a maze or going in circles. It reminds me of an old Family Circus cartoon where the kid is running all over the neighborhood. But where we want to be is where you can, with one door, access a whole different range of services and supports that help us live at home, or our parents or our loved ones live at home as we age. Maybe meals coming in a few times a week would be helpful. Maybe some personal assistance, maybe a one-time home modification, maybe some counseling. Any range of services may help us live at home, live independently, live in our community of choice as we travel through the many stages of aging. As Dr. Louise Aronson tells us, our own aging journey will be different over the years based on our preferences, our family, our values, and we want to have those choices available in an easy way for all of us, no matter where we live in the state, no matter how much money we have, no matter what language we speak. So that's the kind of picture, if you have in your head, of moving from the tangled knot of maze to a hub with spokes. Okay, let's go to the next slide. What does that mean? So what we mean when we mean hubs and spokes is we are making a proposal for discussion over these next few months of what would it mean if we embraced as a state a framework, if you will, a framework or a blueprint of hubs and spokes for every community to move towards. This would mean that you'd be committed to this person-centered, equity-focused, data-driven way of providing services and outcomes. The word framework is important because it will be different in every community. California is a state of many communities. The framework that San Francisco has built of hubs and spokes will be different from what Los Angeles built, will be different from our colleagues in the foothills and in Sacramento and Fresno, who we're going to hear from next. So let me go to one more slide before I hand it over to them and dig in a little deeper. I'm going to spend a little bit of time on this because this is the framework and foundation concept we're talking about. Let's start at the bottom, at the foundation. We have come to believe and hear from so many people that the key to providing these robust set of choices as we age is a strong partnership between three central organizations. Your local area agency on aging, we'll sometimes call it the AAA in shorthand. Your county's adult services, these have been growing over the years. And your CBOs, or community-based organizations in aging and disability. For example, independent living centers, key partners on ADRCs we'll talk about, Alzheimer's associations, family caregiver resource, and so many more. Meals on Wheels, I could go on and on. But that partnership between area agencies on aging, which the Department on Aging partners with, county adult services, and CBOs, when those three entities are pulling together in the same direction, miracles can and do happen. So if you have that foundation, what would a shared framework look like that would help all adults in California have that experience of easily defined the choices we need? Here's the 6 elements we've identified as you on the framework part of the slide, the top half, walk in that door on your left. Sometimes called one door or no wrong door, or we're calling it a hub. This is the clear place in your community everyone knows to call when they have questions or need assistance with aging and disability as an adult. We sometimes talk about people know 211, or maybe people know First 5 for young children, but do we know where to call for the second half of your life and the help, information and assistance you might have? We don't have a common brand. We don't have we have a common phone number, 1-800-510-2020, but we could do more to promote that. So that's the hub, the one door, no wrong door, multiple names on there. The second part of a potential framework is the spokes. Once you walk through that door, what's there? Are there connections to all the range of services that you might choose that will help you live at home and in the community? There are many, many, many services. Our department funds dozens and dozens of home and community-based support services, as do other departments and the federal government, tribes, private sector, nonprofits, and it can be challenging. Some people sometimes have mapped it out as the periodic table. So can we help people when they walk through that door connect to the full diversity of services that support the different ages and stages of living? The third plank is about quality. We all know it's not enough just to offer services. We want to make sure we're doing so in a person-centered way, hearing from people what it is they need and they want, to live independently, live at home in their community. And we want to make sure we have equity at the center, that we're not bringing bias or discrimination or access barriers to our increasingly diversified state. So how do we make sure that when that phone number's out there and people answer the phone or answer the web inquiry, that we are doing so as trained and supported as possible to be person-centered and equity-focused. The fourth is partnerships. Aging is everything, as we always say. So while we want to help be that hub and spoke for aging services, we know there are very important partners to truly living independently. One is health plans. There are more and more opportunities with our Medicaid innovation happening in CalAIM, with our new Medicare and Medicaid partnership office at the Department of Healthcare Services. The partnership between aging and disability and health plans in a person-centered way is becoming more important than ever. So how we as an aging network partner with health plans really is a question before us. Two other partnerships that are critical. One is our partnership with tribal organizations. Tribal organizations have a particular culture and approach to aging that we can all learn from, and our responsibility to support the First Americans and tribal elders and follow their lead is upon us. So how we deepen with our over 100 tribal organizations in California and learn from tribal organizations is something we can all commit to as a state. And a third partner, I would be remiss if I did not say this, of course, today, is emergency and disaster services. Older and disabled adults face particular risks, and I know all of our hearts and minds are with our fellow Californians experiencing fire and smoke and evacuations right now. And it's important that those partnerships know the special needs for access and preparation and potentially evacuation support and accessible evacuation sites as more and more of us are facing climate-caused disasters and emergencies. Two other quick pieces we have to acknowledge at CDA is technology and data. To be effective, we need to modernize. Thank you so much to the AAA Association who've been working with us to plan to move from 4 different computer systems into one single statewide system in coming months and years so that we can be more efficient, more effective, help families who live in different areas, and track our data and our performance in a visible dashboard way. And finally, fiscal and administration. CDA has been working hard to modernize and move from some paper-based and contract-based models into a more electronic and allocation models. We were able to do some of that with emergency authority during the COVID, and we want to build back better and continue best in class business practices to make sure more of the money and time goes to services for people and not the back office. As important as the back office is, we want to make that as effective and modern as possible. So that's the vision of kind of a blueprint, if you will, that we'd like to help counties and communities see if that works for you. And if so, what would you need to be successful? So those are the 2 questions we're really interested in. Is this a framework that could work for your community? And then how can we all work together to help you achieve that vision if it is indeed a shared vision? With that, I want to turn it over to leaders we are so lucky to have, as I mentioned, from both Kings and Tulare and Sacramento, from both county and nonprofit, from both direct contractor to subcontractor. We've a couple different voices, and we're hoping that we've got a diversity of voices here from the 134 of you participating, and we'll be eager to hear from you next. I see the poll has just popped up, so perfect timing for you to tell us about yourself, and then we'll hear from Jamie and Derek. Thank you.
Thank you, Kim. Good afternoon, everyone. My name is Jamie Sharma, and I oversee the Kings-Tulare Area Agency on Aging. I'd like to start by thanking the California Department of Aging and the California Commission on Aging for putting on today's town hall and providing us the opportunity to discuss the ways in which we can improve aging in our respective communities. Thank you for having me. I am honored to share a bit of local perspective. Next slide, please. I'll start with a little bit about who we are. The Kings-Tulare Area Agency on Aging, or KTAAA, is a joint powers agreement between Kings and Tulare counties. We are administratively housed in Tulare County Health and Human Services Agency, but all of our programs serve older adults in both counties. Our organization, which was established in 1980, is mandated to provide leadership, vision, and advocacy for older adults. Our funding is a blend of federal, state, county, and private donations, and our programs are a blend of direct and contracted services. As you can see here, we run the Health Insurance Counseling and Advocacy Program, or HICAP, which assists older adults in navigating the complex Medicare system, and the Multi-Purpose Senior Services Program, known as MSSP, which is intended to keep seniors who are certifiably eligible for nursing home placement safely in their homes. We run those directly. I also oversee the County Veterans Services Office, as it blends nicely with aging programs in many ways. We offer a plethora of contracted services that you can also see here. I won't read you this list, but I will mention a few to help paint a picture of who we are. KTAAA oversees the senior nutrition programs, which provide congregate meals in senior center settings, as well as home delivered meals to seniors who are homebound. We also offer an information and assistance phone line, which provides seniors with a one-stop entry point by which to connect to any of our services. We oversee the long-term care ombudsman program, which advocates for seniors in long-term care facilities. And we offer family caregiver support, legal assistance, transportation services, and through a partnership with our behavioral health department, we also provide mental health screenings and connect folks who need it with behavioral health services. We are blessed by numerous local and regional partnerships and collaborative opportunities. We work closely with our colleagues at in-home supportive services, adult protective services, the public guardian and conservator in both counties. We partner with the local offices of emergency services, all branches of law enforcement, and our healthcare partners on emergency and natural disaster response. We work closely with our colleagues in public health and in behavioral health to ensure that the many and varied needs of our seniors are being met. We are active in our local continuum of care on homelessness and regional transportation task force. And I share all of that to say that in many areas, the hubs and spokes model that Director Wade introduced us to can and does work. Okay, so enough about us. I was asked to share some perspective on what opportunities and challenges exist locally and on recommendations for moving forward. So in terms of opportunities, I think the big one on everyone's mind is the Master Plan for Aging. The Master Plan provides a local blueprint to help guide us toward age and disability friendly communities for all older Californians. The Master Plan for Aging includes numerous distinct initiatives, which allows us to take a long, hard look at how things are going locally and provides a blueprint to help us improve where there are areas of opportunity. We've seen incredible support from our legislators this year. Their continued support will be integral as we strengthen and streamline systems. Advocacy remains a key opportunity for the Central Valley as we strive to increase our visibility as a region and push forward the needs that are specific to our rural communities. Another incredible opportunity facing our region is the expansion of the Adult and Disability Resource Connection, or ADRC network statewide. We do not yet operate an ADRC in Kings and Tulare counties, but it absolutely remains our goal to do so. This opportunity would allow us to further streamline the navigation of services for our older adults and offer a true one-stop shop where older adults, our disability community, their family members, and caregivers can all connect to the resources that they need. Next slide, please. There are certainly challenges as we address the needs of older adults locally, some of which have been highlighted during the pandemic. For one, we've seen an unprecedented growth in demand of our services. Can I ask you to back up one slide for me? Perfect, thank you so much. This ranges from a roughly 400% increase in the need for home delivered meals to the effects of the very real social isolation and loneliness concerns that many have experienced this past year and a half, to the increased legal concerns around affordable housing and eviction that have come to light. It has become more important than ever that we ensure adequate resources to these programs so that the needs of our older adults can be met with compassion and dignity. Another key challenge is the need for flexibility in funding. I am proud and honored to share that we have seen more flexibility in the past year than in the rest of my tenure combined. This flexibility has allowed us to utilize our limited resources in the areas of most need. It is more important than ever that we advocate for continued flexibility beyond the pandemic and focus our efforts on meeting seniors' needs as our local realities indicate. Yet another key challenge is the need for volunteers. Many of our programs are dependent on the participation of volunteers. And during the pandemic, the volunteer pool took quite a hit. Most of our volunteers are retired professionals, which is amazing, but many of them fell into the stay-at-home orders that impacted individuals over age 65. We have a dire need for volunteers in many of our programs, so expanding the volunteer pool is of utmost importance. Moving on to lessons learned as we supported older adults through a global pandemic. A few things come to mind here. For one, the emergency relief funding that has come through in response to the pandemic has been a true blessing. We have proven to ourselves and others that given sufficient funding, we can and do accomplish incredible things. I mentioned previously that our roughly 400% increase in home delivered meals. What that looked like for us locally was about 48 hours notice that all of our senior centers needed to close in order to minimize risk of virus exposure. And all of those participants needed to be transitioned onto home delivered meals. I can honestly share that I have seldom been so proud in my professional life. We were able to transition every participant and accept the ever increasing program enrollees with a very short turnaround. Because of the additional funding and the flexibility to use it as need be, we were able to ensure that every Kings and Tulare County senior remained fed. Doesn't get much more heartwarming than that. Other important lesson was the need for AAAs to be prepared and ready to deal with older adult needs during a crisis, emergency, or natural disaster, as Kim mentioned. Prior to the pandemic, when the sheriff called and asked how many seniors we served and where they resided, I could answer within a few minutes. But more recently, those inquiries have become more involved. In addition to how many there are and where they reside, questions like, which ones can travel without assistance? Who's medically compromised? Whose medical equipment or medication requires continued electricity have come to light. We now have tracking in place to truly assist in the event of an emergency. Providing adequate resources and guidance is of vital importance to ensure that the aging network remains a resource during the emergencies that California is likely to experience. Next slide, please. And last but certainly not least are some recommendations in relation to how the state can best support our region. The things that come to mind here are the need for support of programs that are person-centered and which ensure that the focus remains on the client experience. The need to ensure that existing programs have the support and resources that they need to remain whole prior to taking on new ventures. We need continued technical assistance and training on the person-centered initiatives we provide and those that we aspire to. We need to continue the effort to streamline funding, as this is truly the only way that we can reduce the existing silos to provide easily navigatable services. We suggest local flexibility as often as feasible, as we know the needs of our respective communities. We have an opportunity to facilitate joint projects and regional contracts to assist one another when and where it makes sense. The Central Valley is an amazing place, and we're excited to make it even more age and disability friendly together. That concludes my presentation. Thank you for having me. And with that, I will pass the baton on to Derek.
Thank you, Jamie. And first and foremost, I would like to thank the California Department of Aging and also California Commission on Aging for inviting me to talk about some of my perspectives on how we can move forward in the space of aging hubs and spokes proposal. So first of all, I'd like to introduce myself to all of you in the audience. I currently serve as the president and CEO at ACC Senior Services, which is a private nonprofit organization founded back in April 1972. So next year, we'll be celebrating our 50th anniversary. So we have been providing health, social, and supportive services in Sacramento, California, including a 99-bed skilled nursing, a total of 96 units of assisted living, 30 units of memory care, 146 units of independent living. We also have 21 vehicles on the fleet providing transportation in 10 different zip codes in Sacramento. We offer lifelong learning and wellness programs. We provide a senior employment training, family caregiver support, and most recently, a senior safety collaborative in response to the anti-Asian hate. ACC Senior Services also has created a subsidiary organization by managing the Meals on Wheels of Sacramento County. We call that the Meals on Wheels by ACC, and we provide traditional congregate nutrition, home delivered meals, and also non-traditional meals. So before joining ACC Senior Services, I had the opportunity to serve more than 12 with the federal government as a federal project officer at the U.S. Administration for Community Living under the U.S. Department of Health and Human Services. So in that capacity, I work with the beautiful state of California. So I have known CDA very well for many years. Also state of Hawaii, the territory of American Samoa, and also 60 different tribal organizations in California. And also one thing you may not be aware is in my former capacity as the executive director of the San Francisco Department of Aging and Adult Services, I was part of the early adopter of integrating services for both older adults and persons with disabilities in early 2000, so following San Diego County. And so in that space, we integrated the Area Agency on Aging, public administrator, public guardian, public conservator, representative payee, adult protective services, the County Veteran Service Office, and senior escort program in City and County San Francisco. So when we started, we were at about $11 million. And when I left in 2005, we were up to $30 million. And most recently, I heard that the budget has grown 12 times and reaching about $370 million. So that's quite a big accomplishment. So next slide, please. So I have been asked to talk about some of the same areas which Jamie has covered. And so in the first category, key opportunities, I think that the technological, medical, and social advances really have offered a multitude of opportunity, longevity, wellness, lifelong learning, and care and support in settings of choice for older Californians, which we have never seen before. And also we have witnessed a mix of public-private efforts and investments at the state level. And we are advancing the California Master Plan for Aging, which I'm part of the Stakeholder Advisory Committee, and also improve options and quality of life for more people. And then also we have seen a shift to home and community-based services and uptake of integrated models of care, which provide consumers more tools to direct their care in the whole spectrum of long-term services and support. And then also one thing I would like to point out as a key opportunities is the support from local funders. I just want to give a shout out to the local area agency on aging in PSA 4, and that's AAA 4. They have been very supportive to nonprofit during COVID-19. And that allows ACC and Meals on Wheels by ACC to pivot in serving the unmet needs of older Sacramentans by providing us with a rapid response to serve them. Say, for example, in the Meals on Wheels by ACC space, we receive additional dollars to hire additional staff members, purchase a walk-in freezer to expand storage space, rent a third office to physically distance staff, and have a backup site to produce meals in case of an outbreak. Also allow us to purchase additional PPEs for staff and volunteers, purchase a forklift, and pay for emergency meals to continue feeding the most vulnerable members of our community during the COVID-19 pandemic. Also, the staff at AA4 help us by delivering meals to congregate nutrition participants and conduct wellness checks. And so that's really demonstrated the partnership between the local area agency on aging, by the way, is a joint power authority with 7 counties. And then on the ACC side, the transportation program also received support, additional funding from the area agency on aging, and allowing us to deliver home delivered meals for the Meals on Wheels participants 3 days a week after the shelter-in-place order went into effect. And also we have been recognized by the Area Agency on Aging as an innovative program. So if we can move to the next slide, and I would like to cover some of the key challenges. So even though we have a great California master plan for aging at the state level, at the national level, we have witnessed a lack of national policy and investment, and really depends on the administration. And this will slow down progress and innovation and perpetuate inequities in access to health and long-term services and support. So I looked at this as one of the key challenges. So COVID-19 during the past a year and a half really has created a lot of impact on our staff, on our volunteers, on the organization, the clients, and people we serve. Within 1 week after COVID-19 restrictions were in place, we immediately canceled non-essential in-person services and activities. And within the first month, we modified the essential services to ensure staff and participants are safe and to reduce the likelihood of exposure. And each of our 5 buildings implemented stricter surveillance protocols and has maintained constant communication with local and state health agencies. We also modify activities and emphasize resident engagement because we want to deal with whole notion of tackling socially isolated incidents. We also embrace collaboration by establishing a green zone as our brand new assisted living so that we can allow 16 skilled nursing residents who have repeatedly been tested negative for COVID-19 to have a safe environment to stay. We also have adopted digital transformation, which is prompted by the pandemic and fueled by determination to maintain community connections. And so as of the end of this month, we have launched over 350 online classes, workshops, and concerts. We also have set up on-demand, on-site testing, and this is to minimize hospital readmissions from residents back to the hospitals. We also have innovative adaptation by utilizing technology to enable residents connect with their family members and loved ones virtually, and we adopt indoor visitation protocols so family members can visit the residents up to 30 minutes in the special enclosed area at the skilled nursing. We also have on-site vaccination clinic to make sure that residents and staff will get the vaccination. So a total of about 420 residents and staff have been vaccinated. And most important of all, we get outpouring support from our community so that we are able to sustain the operation during all this time. And last but not least, in terms of key challenges, is the notion about recruitment and retention. And this is not a new problem. It has been in existence for the past 30-some years. But the onset of COVID-19 really has exacerbated the problem. So with that, we are not going to be sitting ducks and do nothing. We have implemented a staffing action plan to mitigate the problem, including adjustment of salary. We offer sign-on bonuses, referral bonuses, and other incentives to mitigate the challenges. So last but not least, I'd like to turn to the last slide I've prepared for you, and that's the recommendations. So as a professional who really embrace diversity, equity, and inclusion, I'd like to recommend to the state to incorporate DEI in funding allocation. I know this may be radical, and basically funding is allocated based on population and some of the other criteria. But may I suggest the state to pivot to incorporate DEI, say for example, putting more weight to rural and small counties due to the fact that they have less access to other resources. Food for thought. Second is we have heard about this great idea of having aging hubs and spokes which are truly embraced. In the meantime, each planning service areas and counties have unique needs and challenges. So I recommend that in the true spirit of transparency, we need to be intentional by involving everyone in key decision-making process and also allowing time for input from everyone. And last but not least is what Jamie mentioned is about local flexibility. And again, because of the unique needs and challenges, I'd like to propose that we allow that so that they can have a say in the final version of this aging hubs and spokes model. So thank you very much for your time, and I would like to turn to the coordinator of this event. Thank you. Bye-bye.
Fantastic. Well, thank you all so much. We're going to turn to Q&A discussion. Thank you, Nancy, for spotlighting. And just a big thank you to all of our speakers today, Ellen, Director Wade, Jamie, and Derek. Thank you so much for your presentations. For those who are joining us as guests and have been listening in, you can engage in Q&A through, well, 3 ways, really. On your toolbar, you'll see a Q&A icon. You can submit your questions or comments there. You could also raise hand, that's on your toolbar as well, to join the queue, and we'll open your line to hear from you. And for those folks who are joining us by phone, you can press *9, and that will enter you into the queue, and we can open your line for comments or questions. So why don't we start with somebody who's had their hand up for a while. Sari, we're going to open your line. You'll need to unmute, and then you can jump in.
Hello,
Perfect. Hi.
can you hear me?
Yes.
Yeah, my name is Sari Tenpapon. I'm a Leusen senior. I'm glad to be a part of this meeting, but I just want to tell you guys that my family have 5 senior. I myself a senior 65. My wife, my mom is 84. My uncle, my aunt. So looking at my family, Laotian, not from Asia, but not big community, but to me it's a kind of invisible community. So we came here as a refugee, and then from Southeast Asia, from Indochina many years ago. But most of our first generation senior right now, but we need a lot of help. We don't really have assistance as we supposed to. So looking in my family, myself too, we struggle to cope with the aging problem, aging issue. So I just want to take that opportunity to tell the policymaker, people that try to develop the program to meet the need of our diverse state, and which is the California state. Even like Asian community, there's many different Asian people from different regions of the Asian continent. So not one group, not one Asian group can represent all the Asian people. So I just want to bring the issue to your attention. Thank you so much.
Thank you.
Thank
And
you
I
for
do want to ask our team that to make sure that we have in the Q&A, and we announce, I think we have a slide that for anyone now with questions about local services or resources, that we do have the statewide number available, 1-800-510-2020, to be connected to your local network of aging leadership. So in addition to your comments and questions, we absolutely want to make sure that your questions for services and needs are met. Thank you so much for those comments. That's the comment slide, but I also want to make sure people know how to get help and get information. So let's maybe put in the Q&A the INA number if we can, team. Thanks. But otherwise, keeping the slide down so we can see who's talking is always wonderful.
Thank you so much. And Carol and I are actually tag teaming today between Q&A and then folks who have their hands raised. So Carol, I'm going to pass it to you. And I do want to flag that we've got staff who've been responding to questions throughout the webinar. So I do encourage you to check that Q&A. If you submitted something earlier, there might be a reply to it that is not formally addressed as part of the Q&A discussion. Carol, go ahead.
Sure. Kim, the first question is for you. Hubs and spokes is one issue, no wrong door. Reconfiguring PSAs is a completely different issue. What are the reasons why CDA and the master plan are focused on reconfiguring the PSAs?
Sure. So the reason, if this concept works for you, is that when you walk in the door, what matters is the house inside that door. And so while we see the no wrong door as an attempt to bring that one unified front door so everyone knows where to call or what website to go to start, When you walk in the door, are there a lot of rooms in that house? Can you find those rooms? Are those rooms connected in a way that makes sense? Those are the kinds of things that we're asking about our foundation and framework. Once you walk in, does that house provide the range of services that you can connect and get to? We don't want that front door to just be, here's a list of things you can call for yourself and see if you can navigate it yourself. We want to be able to help people put together what they choose, what we would all choose to live at home in the community. So it's about going beyond the door to the foundation, the framework, so the whole house makes sense. Another piece of that is that we want on every block in the state, we want the house to have some common standards for performance and for safety. And why I'm going so go far with this metaphor is, of course, it's a framework and a foundation, but when you build that house, you make it your own. So we do know that every community will make it their own. We'll decide what works for Alpine County to Alameda County. But we do think that it makes sense to have some building standards that we all agree on, so that, yes, there's that common front door, no wrong door, ADRC, but when you walk in, you can have an idea of what to expect in that house, and that each house provides what we need to live independently and with the home and communities of our choice. And just so, that may or may not require changing what the plans you already have in your county. That's what the conversation we're looking to engage everybody in now is, how are we doing?
Great. I'm just going to jump in, Derek. It looks like there's a question for you as well. Can you speak to whether you see your agency as a spoke in the system, or do you see it as a hub? And how do you work with the county social services?
Oh, absolutely. We definitely see ourselves as one of the spokes in Sacramento County, because we have different service providers. In the meantime, we are looking at the possibility of being an extended partner with the Area Agency on Aging, and also with Resources for Independent Living, to be an extended partner in the development of aging and disability resource connection in California. So that's answered the first part of the question. So a lot of work still has to be done, but is making some movement right now. I would say baby steps. Another question is, how do we work with the county social services? Well, we currently don't work directly with them, and we do work with the state Department of Social Services, because we are a licensed assisted living in the state of California. So we work with the California Department of Social Services Community Care Licensing. We love to have more opportunities to work with the county social services, so that we can explore common concerns and see how we can, leverage more resources and share some of the ideas to improve the well-being of older adults and disability population in Sacramento. And also, I think there's a question about PSA. It stands for Planning and Service Area. Sorry about my acronym.
No, and Derek, just to fill in on that, in California, we have divided the state into 33 planning and service areas, and a decision made kind of early people can correct me, but 70s, early 80s. And so you may know that California is divided into 58 counties, with each has its own county board of soups. And aging, we've divided the state into 33 PSAs, planning and service areas. Many are single county, but you can tell from the numbers. Some are more than one county. Jamie's got a 2-county one. She's nodding, so good. And Derek's in a 8-county one, I believe, if I have that right. PSA 4?
7.
7, excuse me, I gave you another one, sorry. 7. So we have a mixture of single county and multiple county PSAs.
Rhea, should I go ahead and start with the next question?
Yeah, jump in,
Okay.
Carol.
Sure. So someone wrote, I'm really worried about the AAAs being at the county level. Has anyone been able to get through to the county? They are not very responsive at all. Additionally, county salaries are very high compared to nonprofits, which means more money will be taken away from direct services.
Yeah, I'm really glad to have this worry surface directly. I know this has been something that people have asked about. So the good news in California is we have AAAs at the county, and we have AAAs at nonprofits. So we have that whole experience. It's interesting geographically. In Southern California, the AAA is almost always housed in the county. And in Northern, it's a bit of a mix. between counties, nonprofits, and other. And Jamie and Derek jump in. So, you know, I think I happen to think that both counties and AAAs answer the phone. From my experience at the CalFresh experience, there's phone services and internet services at counties, and there are phone and emails, internet services at AAAs. And our goal is to improve all of that. So I think regardless of how we restructure, we are committed to working with everyone to support rapid response in the technology of choice of people who call. And, you know, yes, there's absolutely pros and cons with and again, Jamie, feel free to jump in here. It is true the counties traditionally pay more than nonprofits, depend on the county, though I will say. And it also, and then there's other considerations that have come up, for example, around sharing health data, what it might mean between government agencies. Other questions have come up around partnering with emergency services in counties and nonprofits. So these are all really, really, really good considerations to surface, and we just urge you to keep them coming and weigh in on them.
Right.
Kim, if I may,
Oh.
yeah, if I may chime in, I have seen both, you know, configurations because of my involvement with the Federal Administration on Aging, and then become the Administration for Community Living. So some nonprofits are smaller, while some are much bigger. So I think the whole thing is really open the option for individual county to have their own kind of local determination. That's the flexibility. And knowing that some counties will have difficulty creating a, you know, area agency on aging if they are split up because of the fact that the county may not have the resources. And so even they may choose to, you know, prioritize those resources in some other areas based on the, you know, unmet needs. So I think my recommendation is to allow that conversation to take place. So which means that there might be more time involved in the deliberation. But I guess with that, there may be more buy-in because at the end of the day is we want to see a concerted effort in delivering services for older adults and younger people with disabilities. And I think in that kind of spirit, we'll get more support after the decision is being made. Yeah, that's my 2 cents.
Kim, I think that the only thing that I would add here is that it speaks to the importance of putting some standards around INA. I recognize that it can be challenging to get through to any given phone number, and we experienced that, right, when seniors wanted to get vaccinated, and we were able to real quickly break 211 and then to real quickly break the call centers that we stood up to assist people, and just the sheer magnitude of calls coming in. So standards around INA, I think, are going to be really important. But I would also like to say that while there are pros and cons to both sides, the other piece of that is that when we in KTAAA, who are, like I said, we're housed in Tulare County Health and Human Services Agency, when we need some additional support, we're able to walk down the hall to our county partners and to pull that additional support. So while it can slow things down a bit, and there are certainly additional bureaucratic processes in place, there's also the other side of it, which I would say is that there are supports available to you that wouldn't necessarily be available to you if you were structured differently. So pros and cons to each side, certainly.
Thank you, Jamie. And while we're on the topic of PSAs, we have a question here. How will reconfiguring of the PSAs impact the long-term care ombudsman programs, specifically ombudsman programs that serve multiple counties?
That is a great question. And the same thing could be asked about HICAP, the Medicare counseling program. That is another program. We are eager to hear feedback on that. It is an open question. There's a couple different ways it could answer. We certainly see the AAA ombudsman and Medicare counseling as an ecosystem. So I think there's desire in making sure that anything we do to streamline and improve and strengthen AAA, we're intentional about the impacts on ombuds and HICAP. I will say an interesting thing that has come up for many people is regional possibilities. So that if there are there's 33 AAAs, but do there need to be 33 ombuds or 33 high cap or 33, or are there opportunities for people to work together and support a regional ombuds or a regional high cap with local, if that was the local's preference, and are there ways that we at the state could make that option as no more or less burdensome, if you will, so that locals could make the best programmatic decision for their local or region and not have one or the other be tricky. So we are open to people's suggestions on those other very, very important programs and what the best way to deliver those services to that maximizes that coordination, but also efficiency.
Thanks, Kim. Carol, do you want to pick the next one?
Sure. If a county wishes to split from a multi-county AAA, how soon could they actually start providing Older Americans Act services, given the legislative and policy changes that would be needed first?
Great question. So that is correct, that if there was a county who was desiring to change their PSA, if they were, we have one of these happening right now, so I'll talk about that in just a second. But if there were folks who wanted to, who were in a multi-county who wanted to go stand alone, please approach CDA. CDA can work to reissue a map under current law, current authority. That does not require changes. And when you do a new map, that does trigger the new selection of a AAA in partnership with the local county board of supervisors who are in those areas. So it would take many months to have a smooth plan to consult and to make that migration with all partners. Again, the big three, AAA, county, and CBOs, to make that work smoothly and subject to federal approval. But that's allowable now. That can happen. And in fact, we are working with LA County and LA City, the one place in the state where we have, if you will, almost nested AAAs. Their board of supervisors has directed them to plan for a consolidation into a single AAA and a independent county Department of Aging that would house the AAA among other county services, as I understand it. And anyone from LA can correct me. So we are working with them through the existing Older Americans and Older Californians to walk through what will be probably multi-year process to plan, get approvals, and execute, so there is no interruption of service to the public, and it is as efficient as possible.
Great. And we've got kind of a comment from Andrew, who wanted to point out that much of the goals that have been described today kind of already exist at a local level, with active and real collaboration between the AAAs, local government, and CBOs. No wrong door has been the battle cry for many years. And there's fear that losing what has been developed over the long term would be disruptive in the least. So I don't know, Kim or others, can you speak to how the process would ensure that the systems that already exist and the relationships that already exist are not disrupted by the proposed changes?
Yeah, part of that is what we're doing right now, is to hear that kind of feedback from people about that, and that any changes will be done in partnership with county boards of SUPs, AAA boards, the legislature, so that any changes that are made are done thoughtfully, intentionally, to minimize transition. So change is always hard. Change is not always better, to be clear. So we want to be really thoughtful about where change might be needed to build back better. And I think we all recognize every community is in a different place on this hub and spoke journey. Ellen's meeting opened us up by sharing the San Diego 20+ year journey. So where you are on the journey will help determine your next roadmap. And we want to make sure that whatever we do helps everybody move forward from where you are.
Thanks. And I've got one follow-up question, and then I'll pass it to Carol to read the next one. So Bobby here is located in Kings County, and Kings County doesn't have a AAA. So how might it affect a county like Kings?
Jamie, you want to take that one?
I think that the honest answer is it would require an awful lot of collaboration and an awful lot of conversation. We know that MSSP and HICAP are in Tulare County, but provide services in Kings. And we know that the long-term care ombudsman is housed in Kings County and provides services in Tulare. So we would each have to stand up our respective programs, and we would each have to figure out what that was going to look like and how we could continue to collaborate and work together. But I think that, to Bobby's point, the issue for Kings County is that the administrative piece of it doesn't yet exist, right? So wanting to put all of those pieces in play together, it would be something that we would have to work long and hard on together to make it work and to make it seamless.
It's an excellent point, Jamie. And it's really that's exactly the kind of analysis and conversation that we're inviting everyone to the table on is what does make sense for Kings and Tulare. And Jamie, I know you all have done a lot of work with your board and both boards of supervisors and your partners on that. But just to carry it out, if Kings were to say, we're ready, it would involve, redrawing the map into 2 PSAs. Kings would get that direct allocation and have the direct responsibility. And again, we'd be working on that. And then I think that's a really excellent question for the Valley. If Kings and Tulare might share the same ombuds or share the same high cap, how does that become efficient and not just a whole lot of contracts, right? So I think those are the kind of questions that we're trying to seek in this process, is get them on the table so we can see if we can figure out if there is a way to do this better or not. And that answer will vary community by community.
Okay, I'll take the next question. If there is an ADRC in place and a AAA in place, where does the client go first? It seems a bit duplicative. Which one is the hub? Which one is the spoke? It seems confusing despite the overview.
It is confusing, and we welcome better metaphors. But the idea is that the AAA with the ILC is the hub, and ADRC is that public front door on the hub. Think of your airport. There's a lot that goes on beyond just the drop off for arrival. That's the hub, right? Whether you go to Denver or Chicago or Atlanta. And so we're trying to find the right metaphor, but we do think it's very important that as while we're standing up a front door that says, here's where you go for services. When you come through that front door, that hub, the AAA and ILC, wherever they're housed, are on the AAA side, wherever they're housed, ILC, we know that network, are able to provide coordinated, comprehensive connections to services. And that's what we really want to make sure happens, that you're able to access the suite of services from community-based organizations, the suite of services from the AAA, and the suite of services from the county. And dare I say, the coming suite of services from health plans, particularly as Medicaid moves into in lieu of services and enhanced care management. So we want to be able to, it's wonderful that AAAs have more services than ever. It's wonderful that our county adults have more services than ever. And it's wonderful that community groups have built up more and more diverse services. How do we help the people in our community get access to all of them? And how can the AAA be that air traffic controller, sorry, another metaphor, to help people connect to all of those and not have to go knocking door to door to door to door. Maybe we can share some more from San Francisco about how, and again, San Francisco is different from everywhere, but how they were able to do that in terms of even things like one waiting list for services, rather than having to call every nonprofit and get on their waiting list. They could coordinate that as the hub. That's just one example. There's many more. So I think we're looking for the metaphor, and we're looking for you to keep kicking holes in it. So keep it coming.
Great. And I've got a comment here from somebody who, we started the webinar out by talking about COVID and the opportunities that COVID has presented, as well as the challenges. This individual just wanted to elevate the AAAs are reeling from the effects of COVID. And what is kind of the time frame for these significant changes? They're hoping that AAAs and other organizations might have some time to kind of recover, get back on their feet before taking on this new initiative.
Sure. So right now we are in month 2 of a 6-month listening process, stakeholder engagement process, to get people's input. We're doing it now because of the urgency of COVID. We are doing it urgency now because the opportunity of the funding and because the direction of the master plan and the Alzheimer's task force. So this is 6 months of listening and thinking. And as we said in December, what will come back is reflections and recommendations. Is that our current phrase? What we heard, findings and feedback, what we heard and what could go forward. But you're absolutely right. These things will take time. They will take reflection by state legislature, county board of soup. Some of them will require federal review. So just to be specific, One thing could be an update to the California federal state plan, which is due next July 1st. This could inform our state plan update. This could inform local plan updates that might be due in coming years. It could inform a budget request from any quarters. It could, as you all know, many people on this call know, the network did receive, requested and the legislature provided and the governor signed a increase in administrative funding for AAAs. So it could lead to some budget. And it could also lead to some modernization of the older Californians Act, which could use a fresh look in the wake of COVID and the master plan. So those are all things that would take time. One of the timeframes that's on my mind, I'll just share, is a lot of the one-time funding investments we have been so fortunate to receive from the federal and the state level have a 3-year horizon. I'm thinking of the proposed federal home and community-based services plan that's pending approval at CMS in Washington. That's a 3-year spending plan. And I'm thinking of the new older adults resiliency and recovery fund in the state budget, also has a 3-year, and some of the COVID money as well. So that's really a golden opportunity if money is helpful in any kind of restructuring, modernizing, holding harmless. I know in the past, sometimes AAAs who've been considering splitting from 2, 3, 4s into 1 have been worried about the pot going down, and maybe there's an opportunity to hold harmless. So I think about the next 3 years as being really critical. But the point is, nothing's happening overnight. Nothing's happening before December. Nothing's happening without the strong local leadership. We've already started to get letters from counties and board of supervisors, and we welcome those. So this is the beginning of a process that will be thoughtful and intentional and transparent and collaborative.
So one participant has identified a challenge. A challenge I haven't heard yet for both AAAs and counties is inequity that exists just based on where you are geographically. Some counties are rich with general fund and have contributed heavily to older adult programs and AAAs. Those programs are wonderful. We all want those kinds of programs. How would CDA approach these areas like the Central Valley, Fresno? All of the studies show dismal ratings for social determinants of health and employment issues. Would there be, I lost the question, it popped out.
Carol, I'm happy to jump in.
Thank you.
I've been keeping an eye on it. Would there be some additional investments in poorer counties to create a foundation for robust services to be developed? And I apologize, Brenda, I realize I'm reading that really fast. We also have difficulty recruiting professionals and require some capacity building to begin the resources needed.
Joy's absolutely right. And that's part of why this opportunity with unprecedented federal and state resources in our network is one we can't squander. So correct, there is not equity between regions, and we need to do everything we can to address that. I do think that the quadrupling of resources for meals, making ADRC funding ongoing for the first time, nutrition infrastructure grants. Is that the first time for this network? I believe it's been at the food banks for a few years, but first time. I mean, I could go on and on. It is really a time to be thinking both about immediate response and capacity building. And we do want to work with groups if there are challenges in spending down the money because of workforce issues, because of local provider networks. We want to be innovative and creative, particularly with the state funding where we have that flexibility. Maybe it's a regional solution. Maybe it's a new partnership. What can we do to help keep that money in your region where people have those needs? And I would just flag that a major part of the 2 other investments. Workforce is a major priority. Direct care, home care, personal care is a major priority of our home community-based service spending plan that our Department of Healthcare Services, CDA, will be leading a new effort to try to increase the supply, the retention, the satisfaction of direct care and the quality of direct care workers. And then I would also just say that our partners at DHCS will be doing a roadmap, many of you are aware of where home and community-based services exist in the state, things like adult day care centers, community-based adult services, or multi-purpose senior services. and thinking about how to use those Medicaid and Medicare dollars to build that infrastructure as well. So there again, there's kind of this lining up, even though I know we're all tired and still dealing with Delta and fires and our kids and our parents and everything else that's happened the last 18 months, there is this, stars are lining up in terms of Older Americans Act, general fund, stimulus, Medicaid, and now our new Medicare office. If we can get our house in order, we could really build something to last for the next generation.
Great. We've got a comment here from Anthony. So Anthony just wants to highlight that we've sort of used several metaphors to describe what the future of serving older adults in California is. One door, a house with many rooms. Is there a more defined vision? Will this be an actual location, a physical location where the public can go in person and meet with representatives from various service organizations? Is this kind of a virtual idea? Will it be over the phone? Will there be pilot programs? There's a lot of questions.
All of those are great questions. I'm going to put Derek on the spot in a second to describe how San Francisco did it. Maybe I'll put Ellen on the spot to see if she can describe how San Diego has done it. Jamie, I don't know if you want to describe how Kingston, there's lots of ways to do it. Derek, do you want to start?
So you want me to share the San Francisco experience. So yes, so just walk back in memory lane. And so it was the year 1999 when the controller did a audit of services for older adults and people with disabilities. And so he found that the services were not coordinated at all. And part of that was based on the experience of one of his relatives who didn't get the types of services. So with that, he made a very radical and bold proposal to integrate the departments, which I mentioned during my presentation, including the public administrator, public guardian, public conservator, representative payee, county veteran service office, the protective services, the area agency on aging, and also the senior escort. So we were all kind of put together, and if I may use the term, forgive me for saying this, it's like a shotgun wedding. So we were not willing to be together at the very get-go. But the upside of that was once we were able to integrate into a single department, we saw some, great collaboration. We tried to find a way to really, blend, the staff, morale, because it was hard for the staff to go through that. Imagine you're coming from 8 different departments, right? And you used to have your own department head. So you kind of put together. So that's the first step. And I was with that movement, from 2000 to 2005. So that's the first phase. And then the second phase was when, my successor took it over. And so as I described, we were at $11 million as an area agency on aging before we merged. So after we were integrated with the other departments, we became $30 million. And since, my departure, the department has grown tremendously. And now you talk about a true hub and spoke model because they really integrated the intake and able to basically eliminate a lot of silos. I think that's the key. You eliminate the silos and make sure that anyone in need of services within the city and county of San Francisco, which is a 47 square mile, geographically, can get the coordinated services. But before that, Kim, we actually had a model called the Senior Central. The Senior Central was a product of the Board of Supervisors who commissioned a study to look at how we integrated aging services and disability services together. So it kind of predated the ADRC, and it started in San Francisco, and we were kind of excited about that. So there are like 11 supervisorial districts in San Francisco County, and we had 11 senior centrals. And later it became this, ADRC model. But so that's the walk back in time in terms of how it started. It's not by choice, but basically by legislation. All right. So that's a very unique. Now, if we are looking at statewide, and I think Ellen can address why San Diego went through that. but different counties have different kind of issues and different experience. So that's why I recommend one thing is to provide local determination and flexibility. And second is I also mentioned at the beginning of my key advice is to have a radical approach for those counties with less resources, is to consider giving more weight so that they don't have to scramble for resources to make ends meet. So much for that. Thank you.
Thank you. Ellen, what is the concept of, or the metaphor of hub and spoke? What does that look like in reality in San Diego?
Well, we had a similar story as to what San Francisco shared. I think at the current time, there's been more evolution with 211. So 211 has become one of the central areas in San Diego that individuals can contact, ever more so during the pandemic. That for individual seniors needing services, vaccines at home, 211 stepped up, referrals to services, 211 available. I think as I look back in the history, a big part of what drove the no wrong door approach for San Diego was the effort to make everything accessible. And senior services were carved out of a model that included physical centers where you could go and learn about public health services or welfare at the time, food stamp, CalFresh and CalWorks and other programs. There was a realization that seniors had some specific needs that needed to be addressed in a different fashion than a walk-in at a center that was devised. So I think that the model for San Diego continues to evolve, and decision for San Diego that we need one central number, 211. It's well solidified, and I just use it as an example for making APS reports, that there's a quick, easy number to call, get into the system and make, especially for urgent matters like APS. It's an evolution and things change. And COVID kind of disrupted all of the ways we do business. And everybody had to find different ways to be responsive to a whole new set of issues. And I think that's one lesson I take away. You mentioned being thoughtful, transparent, open. When I hear the feedback today, I'm really hearing that the need for local flexibility, because each community is so different. So knowing that there are certain core standards that have to be met, but making sure there is that ability to devise and utilize those standards at the local level that makes sense in that region. So it is definitely a natural tension that exists between centralizing and local services. But I think the journey will be exciting. It'll be unique.
Yeah, I think that's part of why the state is trying to speak in as a framework, as a blueprint, as a concept, because it really does require that local determination, local expertise, local prioritization to make it really work in each community. So let's travel back to the Valley and hear from Jamie. How a hub and spoke, you mentioned you've done a lot to coordinate. You haven't taken the ADRC, but where would you say, what does hub and spoke mean in Kings and Tulare?
Yeah, so as with most things, Kings and Tulare is a hybrid. We've got what I would really consider the genuine hub and spoke piece is really our INA line. That's where everybody gets started. That's where everybody enters the system, and that's how they get connected to any of the programs that we provide. Now, that being said, we still have our programs provided in brick and mortar buildings spread out all over the two counties. And an interesting point, I think, to Derek's point about San Francisco and their 47 square miles, is that Kings and Tulare County has 6,200 square miles, right? So there are still challenges. There are still room for growth and opportunities, because even if someone calls the INA line and we feel very secure that we've got a knowledgeable home team who's going to connect them to the right place because they ask the right questions and people are not going to get bounced around from one area to the next, we also know that there's a good possibility that people enter our system due to one need, and then we determine that there are a variety of other needs at play, right? So we still have the situation where they can call into INA, we can connect them to the right place, but it might just be the first right place, and the brick and mortar building for the second right place and the third right place are located in other areas. So we've talked a lot about trying to bring everybody under one building. We've talked a lot about trying to have our website and our INA line provide services or connect people to services virtually so that they don't have to come in. We're trying to address the digital divide in the Central Valley and make sure that our seniors have access to the internet and the devices that they need in order to do that. So while I'm incredibly proud of it, and I feel like it looks so much better today than it did 5 years ago, I also think that there's a lot of opportunity and a lot of excitement around really seeing what could this look like moving forward and into our future.
Fantastic. Carol, I don't know if you want to pose another question. We've got a couple more minutes left. Carol, you might be muted.
Yes, I am. Sorry about that. How do we know if Hubs and Spokes Network for Aging and Disability Plan is going to be effective for all older adults and individuals with disabilities across the state, including rural areas and counties? Is there data to show that this plan will be effective?
Yeah, that's exactly what we're gathering. And I invite you to come to our particular rural and remote virtual town hall. We're having one just on the specific challenges of rural and remote because there's so many. And I recognize that the Central Valley is everything, urban, suburban, rural, everything is in the Central Valley. But we do want to focus on rural and remote, particularly because we know that, as I think Joy and others have mentioned, or even Jamie, in terms of there may be fewer nonprofit partners, there may be fewer dollars, there may be more miles, there are more miles, there are fewer health institutions. You know, there's things that really need to be thoughtfully thought through. I mean, we are hopeful with some of the new resources coming into adults, again, both from the CDA channel, but also CDSS channel, the housing and homelessness funding, the APS funding, adult protective services, that maybe some of the smaller counties and communities, it may be starting to come together into enough to have that pillar of adult services like has been built for children, which would better reflect the demographics, frankly, in some of our more rural counties that are aging, that are older faster than some of our coastal counties. So I do think those issues are incredibly important. And that's why this theme of what is a state concept and framework that locals can specifically implement. And again, we may need to have some, as Derek suggested provocatively, thank you, some funding, some different regional partnerships, some innovative ways to think about how to support rural aging.
Thanks. And I don't know if we're aiming to end at about 3:30, if we've got a little bit more time. Kim, I defer to you, but I thought this question was kind of a nice closeout question. So where can stakeholders go to find the list of counties that are going to be included in this kind of series of town hall listening sessions?
Terrific. I'll let, we hope there's one that makes sense for everybody, but there are, and Connie can talk more about this, but we started here in Sacramento in the Central Valley. There's one for the San Francisco Bay Area and Central Coast. There's one for Los Angeles and Southern California. And then there is that rural and remote. All will follow the same format of Commission on Aging opening, Ellen and her colleagues, myself giving a short view of the vision, and then hearing from two leaders from that region from two different seats to kind of kick off the local conversation. So the calendar is on our webpage, and we urge you to come to as many as you would like. That's the beauty of virtual, and help us promote to make sure we have people from those regions at all and able to attend. You're welcome to self-identify as rural and Central Valley, Bay Area and Central Valley. There's no wrong door.
Fantastic. And Kim, are you open for more questions?
You know, I actually had completely lost track of time. So it is 3:30. What would you like? What would the group like to do? I'm happy if you see more questions that are new or different that we should, I defer to the group. What's the best thing to do?
We've covered a lot of the ground here. I mean, there's definitely comments and questions. Well, maybe Connie, do you have a sense?
Yeah, I was thinking just so that we can end on time because we don't want to take more time than what we originally had promised folks. And there are still some questions that we weren't able to get through in the chat that came through. So what we're going to do right now, currently on the webpage, on the Hubs and Spokes webpage, there is a section where we're putting up, you can see like questions that have come in that we've answered. We'll put these questions that are coming in through chat, the ones that we've already answered and the ones that we haven't been able to answer, and we'll put them up there so folks can see some of also the comments that are made. So we'll do that just so that we can wrap it on time and not overextend the time that we originally allotted for. And also this full town hall is also going to be recorded. If you've missed any parts or you wanted to watch it again, that will also be available. You'll be able to get it on our YouTube channel or also on through the Hubs and Spokes page as well. Everything that's related to the Hubs and Spokes initiative, whether it's the town hall, the webinar, the survey, all of it will be found on that page. If you can't find it or have any questions, feel free. You can always email us. It's communications@aging.ca.gov. But with that, I'd suggest that maybe we can wrap it. So Ellen and Kim, you guys want to help close it out, or?
I just want to thank everyone for being our first town hall and giving us such great feedback. Please, please, please keep it coming, whether it's as individuals. As Connie mentioned, the public survey is rolling out today. So please take the public survey as individuals and forward it to your networks. And we also invite recommendations from organizations. We know that C4A is working on. I see our HICAP organization and Ombuds organization on the call, and look forward to hearing from you all at future stakeholder meetings or written recommendations. So really, we want to hear from you. We want to make this as informed as possible. And then, really want to hear how your local conversations go, what you think you need from the state to be as strong as you can in your community for the people you serve. So thank you so much for this first session. So looking forward to more to come. And I know someone said the term Build Back Better is being used a lot, but it really does speak to the moment. And we are eager to work with you to build back better for the people we serve. Thank you so much. Ellen, last word.
Yeah, so I just want to say that this has been very thought-provoking opportunity for me. I've heard many different perspectives, and I'm just very, very thankful also that the California Commission can participate. We'll be going back and cogitating ourselves and providing input through the survey and other means. Thank you so much.